world of Zoom. And we'd really like to thank you for joining us, and also for thanking SCOL. This is the SCOL Global Ecosystem Event, Learning from Past to Move Forward. Systems don't have agency, people do. It's part of a SCOL World Forum Ecosystem Day, and it's wholly curated and co-hosted by members of the People First community, which includes Global Health Corps, Teach for All, and the African Leadership Academy. My name is Mark Dybul. I'm currently CEO of a biotech company called Enochian Biosciences. I'm still a professor of medicine at Georgetown University and ran a center there, co-ran a center there on global health practice and impact. Before that, I was the executive director of the Global Fund to Fight AIDS, TB, and Malaria, and the U.S. Global AIDS Coordinator overseeing the implementation of the U.S. President's Emergency Plan for AIDS Relief, or PEPFAR. I'm also a longtime member of the Board of Advisors of Global Health Corps, actually since before it existed, and was lucky enough to meet the first fellows a very long time ago. They bring a wide range of non-clinical skills sets to solving complex global health challenges, and have built a phenomenal alumni network. GHC, our Global Health Corps, alongside the co-hosts Teach for All and the African Leadership Academy, are members of the People First community. It's a global group of practitioners, academics, public and private sector actors with shared belief in the transformative power of training up proximate leaders to drive sustainable systems change in their communities. And that's the key part, in the community. The topic of today is really going to focus on how worlds are different spheres collide or don't collide, effectively or ineffectively, or in a detrimental way, with a particular focus on health and education, and in part because of the overwhelming data on the links between health and education for communities, and importantly for individuals in those communities, to reach their full potential and reach their dreams and ambitions. Just, having been in this world for a while, it's something that I've felt very strongly about and seen on the ground, and something people in communities understand. Education has dragged a little bit behind in some people's views. Global health has been, for the last 25 years or so, something that's on a lot of people's agendas. Norway is a country that saw about 10 years ago what African leaders were telling them, that health and education have to go alongside each other. And so they restructured their development department to focus on health and education as one unit, which is not the case for anyone else. To try to pick up the education sector, they created a very high level commission, global commission, co-chaired by Prime Minister Solberg of Norway, and several African heads of state. Former Prime Minister Gordon Brown was effectively the executive director of that. They put out a really important report. I was invited to the opening session when I was the head of the Global Fund, with all the prime ministers there. I was on a panel with President Kagame from Rwanda, Gordon Brown, former President Kikwete of Tanzania, and a few others. And literally, the education people there were asking, why was I there? What was a health person doing at an education panel? Even some of them even saying, are you trying to get any money that comes out of this? Are you trying to angle in and cut in and get any money? Which I think is a microcosm for, at the global level, how worlds like health and education that so clearly must come together. And President Kagame actually jumped in and said, health and education have to go together. What are you people talking about? These two belong together. We think that's all I think about is health and education. But I think it highlights, at least at a global level, how we get stuck into worlds. And that sticking can cause problems when we try to get down to communities and try to make change in the community. And so this conversation with three people from the communities will reflect on how in the COVID pandemic, but bringing in any other pandemic, health and education have worked together or have not worked well together. So we're very excited about that. And I'm happy to introduce the panelists who are leaders with deep roots in their communities. I was told to say rising leaders, but they're already leaders. Starting with Cornelia, who's currently special assistant to the Minister of Education and a law student in Liberia. She's also the founder of Young Women's Empowerment Network and was admitted into the Order of the Star of Africa, which is pretty amazing at her age for the contribution to Liberia by former President Ellen Johnson Sirleaf, who's has been deeply engaged in trying to link health and education, and in particular, creating leaders for the future. Lorraine is Assistant Director with the Clinton Health Access Initiative. I have to give a little caveat here that I'm on the board of CHI. She's in Uganda in that Associate Director role. And she got her start in global health as a Global Health Corps Fellow in 2013. So it's great to see an alumna in such an important role. And Khadija, who founded Tech for Pakistan in 2017 and has grown it to serve thousands of students across the country in her capacity as CEO. So as you can see, we've got a great group. I'm going to ask the same question to all of them to start, which is for, I think it will be of great interest to the audience here, which is to ask each of them how, as coming into these unique leadership roles and their own journeys, how Teach for All, Global Health Corps, African Leadership Academy networks, how did your involvement with these programs impact you and shape your path to where you are now? So why don't we just start with Cornelia, since we introduced her first. So Cornelia.
Hi, everyone. I'm excited to be here today to share my experiences with everyone, our learning experiences as well. I have been lucky to be a part of the African Leadership Academy's network. I was an inaugural student at the African Leadership Academy. And one thing that that network did for me was to prepare me on a clear map on how to be intentional about leadership, about wanting change, about seeing problems and trying to identify solutions to those problems. And when I graduated in 2010 and came back to Liberia, most of my engagements have been around that. A lot of that experience helped me. As you know, in Liberia, we got to experience two of the major pandemics, health pandemics, the Ebola, which was a shock for Liberia, and the COVID as well, which we currently are in at the moment. And I am currently a member of the opposition, political opposition in Liberia. So engagements, being known that we are from different backgrounds, the ruling party and the opposition, but acknowledging that when it comes to your country and wanting to make change or ensuring that when you have a crisis, you work together. My experience at the African Leadership Academy, everything else helped me to clearly map out a plan that I was able to implement during COVID and that I'll be able to explain as we go along this panel.
Thank you very much, Cornelia. Lorraine?
Thanks, Mark. So a little bit of background. I was a fellow in a Global Health Corps fellow in 2013 to 2014. And one of the unique aspects about that fellowship, which to date still inspires me, is the pairing of the local fellows with an international fellow, which I felt was, for me, it was, I guess, my introduction to what diversity means, and just understanding the journey within the global health space, understanding that my narrative may not necessarily be the absolute. And so helping me, or at least within that space, helping have a conversation on those different perspectives. I was paired with a fellow who to date I'm still in touch with, Megan. And I think one of the opportunities that I would say, moving forward, that I've been able to sort of pursue or look out for is programs or at least organizations. Fortunately, I'm still with the same organization that I started with, but I've been intentional about looking for, or at least embracing difference in opinion respectfully, especially within this space where you have academic, I'm a pharmacist by background, and I think my training sometimes may bias me towards, my own narrative. And so I've appreciated that, and going into the global health space and understanding that sometimes health problems are not necessarily for the scientists, and embracing that as well. That diversity, not only from a cultural sense, but also from a technical sense, I think is something that has stood out for me, and I continue to pursue. Over.
Thank you, Lorraine. I also should mention one, it's pretty remarkable for those of us who are a little bit older to have someone like Cornelia say that she's in the opposition in Liberia. I remember when that was impossible. So it's kind of amazing when the world can change in wonderful ways. Khadija.
Hi, thank you, Mark. Hi, everyone. It's very nice to be here. So I've been in this work now for about 12 years, and I came to it as quite a naive, young 26-year-old. I'm still naive, not very young anymore. And over the years, I've had the privilege to work, of course, with Teach for Pakistan, which is the program that I founded and run, but also with incredible other Teach for All network partners. And when I think about the impact of this work on my own life and my own path, I think the biggest realization for me is that it has made me think very deeply about what are my values and what do I really care about, and then challenged me to live my life in accordance with those values. So when I think about justice or love or of unrelenting hope, can I really live into those, or are they just things that I talk about? And I think the just kind of biggest takeaway and learning from what being in this network of Teach for All has taught me is the power of the collective. I think I at least was programmed from a very young age to believe in like a messiah, the one great savior. And this is the myth that I think a lot of us kind of buy into, right? The one from above who's going to be sent down to earth to solve all the ills in our societies. And I've had to unlearn that. This work has taught me to unlearn that, because changing systems doesn't work like that. And I think to speak truth to power, you need to be able to build power with people who care about the same things that you do. And so that even, in my work as a CEO of an organization, every day I try to remind myself of that, and remind myself that my job really is to nurture and empower and protect the people who do this work with me, and to organize their very conscious efforts in pursuit of the goal that we all share. And so that I think is a little bit of the impact that this work has had on me so far.
Thank you, Khadija, and stay naive. It's a good thing to have for as long as you can. Naivete mixed with wisdom becomes a very powerful thing. And thanks for emphasizing, all of you, the power of people and individuals, because that's where everything starts. And people live in communities, and that's what we're going to be talking about today. So thank you for those introductions to yourself. You're amazing people. It's a privilege to be with you. So, what we want to talk about today, we've introduced a little bit, but to put in a more formal question, there are health crises like HIV, Ebola, most recently, of course, COVID, have exposed deep inequalities all over the world in health and education systems. Yet, too often, I gave an example globally, there have been huge gaps between decision makers and communities. We tend to, fall into our communities of what we're interested in, whether it's health, education, nutrition, whatever. But yet these are jointly impacted by inequities and by things and pandemics. So from each of your points of view, in particular from the countries you're in, the communities you're in Pakistan, Liberia, Uganda, very different places. Where did on the ground community perspectives and proximate leaders inform national or regional responses during various crises, COVID, Ebola? and where did decision making happen in a vacuum to the detriment of communities? And how did you see that happening in real life? So why don't we go in reverse order this time and start with Khadija.
Thanks, Mark. Yeah, I think so. When COVID first hit and schools closed all over Pakistan back in March 2020, it seemed like nobody had any answers of how do you continue learning for students who live and study in poverty and don't have access to laptops or tablets or Wi-Fi. But the Pakistani government's response, I think, was astonishingly rapid, actually, I would say. And it was very, very tuned into the realities on ground. So within a month and a half of schools closing down, just in the first wave, the federal government had up and running a national education channel that was broadcasting content to Pakistanis all across the country, regardless of where they lived, how urban or how rural they were based. And they continued to iterate and improve that content because they involved just a very, very wide array of stakeholders, like teachers who were feeding into what is the curriculum, what are the most important things that kids need to learn and can learn through television, edtech firms, advocates on the ground who were raising their voice for how many grades to cover, what content to add, what to leave behind, things like that. I think on the flip side of that, I feel like, is another example where our government was already pre-pandemic planning to launch a new curriculum that certainly had promise, but the timing of that needed to be thought through very well. And they happened to launch it just as kids were returning and schools were reopening. And that in a system that was already so unstable and there was so much uncertainty on the ground, and teachers and students and parents alike were just trying to cope with the pressure of now being back at school with all these learning losses. It just felt like a very wrong time to be launching a brand new curriculum without any support to the educators on ground. And that to me, I think, is an example of where we failed to connect policy to what's actually happening.
It's a very good example, and learning from failures is one of the things we often don't do. Of course, with Pakistan's current political crisis, things could get even worse, but maybe we can bring that in a little bit later, and how political crises can bring people together or separate them at the community level. So why don't we go then to Lorraine?
In Uganda, I think we were among one of the countries that had one of the longest lockdowns. We were closed schools were closed for 2 years. And in the, once we opened up, one of the things that our health data showed was a surge in teenage pregnancies. And of course, there was quite a clear correlation between the periods when the country was locked down or partially locked down and when we saw this surge. And so within the corridors of ministry, there has been this conversation around, the ministry was consulted, the Ministry of Education was consulted. However, the conversation perhaps did not really think about the environment that these adolescents are living in when they are within their communities. And the focus was more around, let's keep the people safe, no matter the cost, we'll deal with the pregnancies when they come. And so now it's like, the ministry is now thinking back and saying, did we mess up? Should we have actually opened up because we couldn't really protect these girls? We've reported pregnancies as young as 12 years old, right? So it's even before the teenage, period. And so there's this question around, as you try to protect the greater population, from spreading the virus, right? How far can you go when you have environments within communities that are not conducive for that kind of lockdown situation? And so I think there hasn't necessarily been a consensus, but increasingly, and even within the donor community, we're seeing a lot of conversations around, what programming can we now integrate within either our education system or our health system that addresses the realities of these adolescents that are faced with, complex situations that, may find themselves mothers within the next year or so. So it's a bit of a challenge right now, but I think the breakdown in the decision making was maybe walking the journey of an adolescent and trying to actually make a decision around lockdown as an adolescent and not necessarily as a minister of health or a minister of education. Over.
Yeah, it's a very important point. I want to come back to the points you both made in the next question. Cornelia, if you could talk a little bit, and I don't know if you want to bring in Ebola as well, since Liberia was so devastated by Ebola, and actually maybe use some of those lessons as COVID came upon you. But let's hear from you, and then we'll circle back on some of the interesting things that came up in this first round.
Okay, so Liberia experienced both Ebola and COVID. When Ebola was in Liberia, for us, it was shock. I wasn't as involved in it, but felt the pinch of it. The community I lived in, we lost more than 20 persons just in the community. They had to lock down, schools were closed, and there were a lot of issues with food, and because the economy here is pretty much, you go to the market, you get a little money, and then you sustain your family. So everything shut down for a very long time. So when we had the issue of COVID, by the time COVID came, at that time, I had already contested for a legislative seat in Liberia. So I was more involved in policy discussions and more involved in politics in Liberia. One of the things that we saw in Ebola that caused a lot of death was the doubting. A lot of Liberians doubted that Ebola existed. They felt that it was just one of these scams, trying to keep people in their houses or trying to just shut everything down. So it took a long time for us to start to believe that it was real. And when COVID happened, we had similar things, but this time it was from another approach. The people, they didn't have trust in the government because of the level of corruption and everything else. So by the time they heard of COVID, they thought it was a scam to get money from donor aids and stuff. So there was this whole misconception and a serious resistance from the people. Being an opposition leader and one, I currently serve as the official spokesperson for my party. So I spend almost all the time criticizing the government. And one of the things that we saw that we could do from my district was to speak out and tell them, in fact, COVID is real. There are a lot of risks associated. And if we do not take steps to prevent the spread of COVID, we're going to die. Being one of them, they saw me as one of them because we all will sit and criticize the government. So they felt, okay, if she's an opposition and she's saying this is true, maybe it is true. So gradually they started to open up and become more receptive to tackling the COVID issue. We're able to set up community teams, community engagement teams that will supervise hand washing station, make sure that every house had a hand washing station, and carry out awareness. So what really happened there was having a community approach, having one where you do not see it as a government project and keep aside the opposition and everybody else. And once you reach at the point where you all agree to, okay, we have differences in policies, in ideologies, but when it comes to a major crisis of the nation, we have to put that aside and work together. And that was one of the lessons that we were able to learn from this particular experience.
Thank you. That's a great example of what can happen when people listen in different ways based on where you're coming from. As an opposition leader, recognize they can't be the government because the opposition is also engaging. You've each touched on failures and some successes that happened during COVID. Maybe it'd be useful to hear from you. Say you were in charge, and the people in this group were in charge. What would you have done differently? What would you like to see done differently? And do you think there's been enough change in your countries to be able to deal with, say, in 2 months we have a new variant of COVID that is highly deadly and more transmissible, or we get an influenza, which we're still watching, outbreak, pandemic, or a new pandemic, which we could have anytime. You know, what do you think the communities have pushed enough, or what could communities be doing now? What would you like to see change that would lead to a different outcome next time around, particularly as health and education come together? And for those of you on the call from the United States, we failed spectacularly in the United States around this. We are no example for anyone. And in our case, it was largely teachers' unions that caused the problem, and party politics. Because there really have been no data for keeping kids out of primary school that you could anywhere since the beginning. So we don't have much to offer on our side over here, at least at the government, at the national or state level. But it'd be great to hear from you as, you know, as leaders in your own right, but also talking to leaders in their own right and the people who will be running your countries. What would you want to see done differently next time around? And what can we start to do to make that happen? Lorraine, you get to go first this
time. What would I want to see done differently? I think engaging, or at least moving from policy, or, you know, these documents that I've been part of writing strategies and policies and shelving them and just wishing that the government would one day commit funding, specifically community health. Uganda already has the tools, the documents, the language, and even when you look at, you know, the education and health space, we have good examples of where the two sectors have collaborated. I've been part of a project that was aiming to bring scale up the human papilloma virus vaccination among adolescent girls. And as you know, the target age group is girls who are 10 years in our country. And so, you know, how do you get these girls who are both in school, and maybe some of them are not in school, right? And one of the strategies that we adopted was, of course, you know, engaging teachers, engaging health workers, but also engaging community health workers. In our country, we call them community health extension workers or volunteer health teams. Most of them are unsalaried. Most of them are very passionate about their work. Most of them are hungry to be part of, you know, these kinds of interventions. But for the longest time, the story has largely been donor dependent. And so I think, you know, if I was in, you know, a position of influencing some of these decisions, I think I would try to push to redirect some of that domestic, or at least government funding, to sustain community health programs. I think they go a long way in really reaching those targeted marginalized groups that, you know, the typical conventional health system is not reaching. Over.
Great, thank you. Khadija, you talked about successes and failures, and now you have a government crisis. Tell us a little bit about how you saw things unfolding and what you'd like to see different the next time, even if it's in a month or two.
Yeah. So I think one thing that would have been, that's really obvious, and I've been saying this now for 2 years, this has been my greatest frustration all through COVID, has been that the biggest civilian workforce that we have is teachers. And in the education response to COVID-19's disruption of schooling, the teacher workforce was the one that wasn't activated at scale. It just didn't happen. And so at the scale that Teach for Pakistan operates, for instance, our teachers were innovating, thinking, problem solving, connecting directly with their students, figuring out how all of the many ways in which they can continue learning and also keep their kids safe and also protect their children, their students' emotional and psychological well-being. And it just felt like, as we were doing it, it just felt like this isn't rocket science. Like, this is something that's, that really any teacher, if you were to empower them and you were to say, yes, you are the leader that we need right now, be that pillar of strength for your community today, and what do you need? We're here behind you. If we did that as national policy, I wonder what could have happened, because these are the people who are closest to the problem. They're the ones who know their kids the best, the ones who come to their classrooms, right? And so I think that's kind of my biggest one. And but I think on the whole, Pakistan like fared quite well during the pandemic, which gives me hope that some of the basics we're starting to get right. So we'll get through past this political turmoil, and we should be back on our feet very soon. We're good at that, bouncing back.
Yeah, Pakistan did do quite well, especially certain regions. Cornelia, tell us a little bit about what you would like to see different.
What I would like to see different, first and foremost, is collaboration. I believe that once you collaborate, you always find a balance in ideas, in how you can find solutions. So where one person has limited resources, or other person comes in from that end. Another thing would be early preparation. We saw that here in Liberia during Ebola. We were not prepared, obviously. That was a first for us, and everyone was confused for the first few months. We didn't know where to start, how to approach it, and as a result, we saw huge death rates. By the time COVID came, because we had some experience in Ebola, we had come up with some sort of protocols on how to deal with Ebola. And Ebola and COVID was somewhat similar. It was easy to, in less than a month, adopt whatever we had for Ebola to COVID and apply it in this new instance. Like doing handbooks that will look at what do we do, for instance, if there is a pandemic that you cannot touch each other, or that's airborne. What do you do? How do we start? How do we tackle the education sector? How do we deal with the economic sector? Because people have to go to sell, people have to go to jobs, and all of that. And for example, it makes it easier when we had COVID, transitioning from physical classes from school and going online was easy. Some of the elementary school that didn't have access to internet, they could do booklets for the students and take it home for the parents to teach them. And that was because we had learned from Ebola, and now COVID made it a bit easier. Another very important thing is to include grassroots mobilization, or include the grassroots in most of your works, especially in Africa. In Africa, we have like a huge grassroots movement. And if you want to fill in anything, you should, by the time you leave them out, you automatically going to fail, because they make up the majority of the people that you bring in these solutions for. So what I would like to see done differently is to include the grassroots from the very beginning. So have all the different sector players, education, health, the foreign affairs, and everyone, but also include the communities and grassroots leaders, so that whatever decisions are made, is easy for it to trickle down to the people. And again, most importantly, budgetary allocation. You need funding if you must implement most of these things. So we have to start thinking of having, in Liberia, we don't do that a lot, having an emergency fund for just in case. Now we know these things happen all the time. So there is somewhere that you can go when you have a pandemic, for example.
Great, thank you. And if we did all those things, we would be in much better shape for not only the next pandemic, but a better world. Just a heads up to those online, and after this next round, we'll be taking questions out of the chat. So please go ahead and put them in, or We can also just call on you. If you do put something in the chat, I can call on you to verbally give your question. Last question, just quickly from each of you. We've got a great organization, People First Community with Global Health Corps, Teach for All, African Leadership Academy. SCOL is very involved and very important group. There are others out there. There are groups of young entrepreneurs, especially in the crypto world, that want to give away, all their billions of dollars. What would you like to see people do at that level differently? What do you think needs to be done for leadership training so that the next time there's a meeting of a commission on education or a commission of health, no one is upset that health and education are together? In fact, that you would automatically have a commission on health and education, or health and education and development, or that we would start linking worlds. What would you like to see happen differently and to make a different future in terms of that? Why don't we start with Khadija?
Yeah, Mark, to me, I think it's really simple. I think when people look at themselves, or they look at their own kids or somebody who they love and they care about, they're able to see them holistically. And so I think, to me, the question of, these intersectoral approaches to change are just so obvious. And I think it's really about, when we are thinking about making investments or finding points of intervention to create change, do we put on the same lens as we would if we were trying to make that change in our lives, in our communities, if it was personal? Do we look at it the same way? Because I think the problem is that, when we look outwards, our lenses are very, very different. And so that's the one thing that I would like to see change.
Great. Cornelia?
Well, if I was to say one thing, I would say get the young people involved from the very beginning so that the transition is easier. That way we don't have to make the same mistakes that I made with the current generation or the older generation. We have hands-on experiences and can easily remember and apply them. So if I was to give like one thing that would make it work, I would say at the very beginning, get the young people involved so that the transition is way easier than what it is. You take less time teaching and training because they're actually part of the process and understand where you are headed to.
Great, thank you. Lorraine?
I'd say immerse yourself in an experience and don't just gloss over it. I'm assuming I'm speaking to some leaders on this call right now. I think it's easier to read about, some of these things about the crisis and, how we should work together. But I think and by immersing, I mean these opportunities that organizations like GHC provide, or, Teach for All, where we're providing opportunities for future leaders to understand the complexities of decision making, I think is the opportunity right now. And sometimes it's not about, it's understanding trade-offs, it's understanding, what's the lesser evil, because, you're in a situation where certain scenarios are not any better. So immersing yourself in an experience, or at least being intentional about understanding a context. I'm going to digress a little bit here, but I think the COVID vaccination situation was a good example of how our leaders need some education. I think there are so many lessons about that. The Global South being left behind because, going into our not having transparency around pricing. Yeah, that sort of myopic thinking that, thinks that's, it's not my problem and so I'm not going to intervene. That kind of thinking that is very myopic and maybe also self-protecting, I guess, may be good, but I think in the long run, everyone suffers. So I would say thinking around that, and especially for decision-making. Over.
Thank you. I think you've all made excellent points. You know, something Khadija said that I've always found is the closer you get to the community, the less these worlds matter, because it's people that you're thinking about, not a discipline or a disease. It's a person. And young people, as Cornelia pointed out, have this perspective, at least in my experience. The trick is bringing it back to what you said, Lorraine. How do we make sure that the generation continues to feel that way, and that there are opportunities and outlets for them to express themselves, so that leaders listen to them, and that as you become the leaders, as the three of you are, we can change all of this. And the three of you give us all great hope that that's possible. So we'd love to get questions from those of you who are joining online. I am totally a Luddite because I'm about twice the age of everyone here. But I will do my best to follow the chat, or if someone raises hands, I can generally follow that. But we love to hear your questions for anyone in this group, any of these three fantastic people. So just add them in the chat, or raise your hand, or just jump in if I don't see your hand. Is there? No.
Mark,
okay.
in case you can't see me, I'm happy to just jump in.
Okay, Heather.
Yep. Hi, everyone. Heather Anderson with Global Health Corps. It's excited to see many of you on the call today. Thanks, Mark, for facilitating. And a question for all the panelists is the question around, like, each one of you are part of really powerful networks, the TFA, Global Health Corps, ALA. And so I'm really curious how you think about the role of the network that you're part of, and you probably are in other networks too, in terms of solving these issues within the systems that you're working in, whether pursuit of equity in health, education, or otherwise. Thanks.
Does anyone want to jump in on that? Each of you should take a crack at it.
Yeah, maybe I could go first. I'll speak for GHC. I think, you know, there's so many opportunities that the network provides. I mean, one, creating a platform for conversation, which I think many organizations are very focused on, you know, obviously, you know, getting their job done, their strategy, their deliverables. And I think what GHC creates is, or at least from my experience, what I've seen is these conversations that are happening in corridors in some of these large organizations, but are not necessarily coming to the forefront, which I think, so for example, even this kind of conversation, right? How do we advance you know, good leadership traits in future, you know, our future generations, or what are some of the things that we should be reflecting on and discussing more intently about, and not just brushing off as, you know, I saw that update and that's it, you know, and that's where the conversation ends. So I think the network provides a platform for conversation and advancing some of these conversations that, you know, you don't really have a solution at the time, but you know that you need to have a discussion around that. That's one. And two, from my sense, it's, I think, you know, elevating that discussion to, or at least getting a different perspective from people with different contexts of different backgrounds. I think what GHC has done a good job of is really harnessing that diversity, especially from, as I'd mentioned earlier on, from a social, cultural, but also from a technical lens. And so I'd say, you know, really elevating the conversation around diversity as well, and how that is plugging into how, you know, programs or how organizations think about, you know, how they program certain projects, you know, how do they think about tough conversations and elevating them to governments that may not necessarily be receptive or be ready to hear the harsh truth about their own, you know, systems. So I know I've probably spoken very broadly and very vaguely, but yes, a space for conversation has been helpful. Over.
Great, thank you, Lorraine. Cornelia?
Yes, so I'm from the African Leadership Academy Network, and we have alumni all over Africa in different sectors that have had many years of different experiences. I would say bring us all together from time to time, like we used to do in the auditorium in Johannesburg at the African Leadership Academy's campus. But not just to bring us together as a reunion or to talk broadly about Africa's problems, but choose one or two sectors, for example. Maybe this gathering is to look at the education or the health sector and choose a couple of country-specific countries, get data on them, what the current realities are, and have us brainstorm actual solutions to some of those things that we can put in the form of a proposal and see how we can get it to reach to decision makers or in those different countries. So I would think that would be a more hands-on approach. So we're not just looking at problems in general and speculating or finding just random case studies. But for example, we do Liberia. Liberia budget has been decreasing from time to time. The economic sector is declining. How can we address this? Liberia has this resource. They have this amount of budget, and let's brainstorm solution. I think with that approach, we find actual solutions to the problem instead of general solutions that we throw around. It might not be applicable to certain countries.
Thank you. Khadija?
Yeah, I think to me, I see Teach for All and what it stands for and what it represents as a network, challenging just the global discourse in education in two very important ways. The first to me is, you know, when I think about when we talk about what we want for kids or what we're aspiring for globally, we talk in very, very basic terms. We talk about getting kids to school. We talk about getting kids to start to read or write at a functional level. And the conversation kind of trickles off, right? And I understand that part of the reason why that happens is because globally the education crisis is massive, right? But it's almost like we are afraid to even reach for the possibility of anything more for kids at scale. We are afraid to dream of anything bigger than that. When I talk to anybody from the Teach for All network, anywhere in the world, one thing that I feel like we have in common is just holding a really high bar for what we want for kids, or what the aspiration is, right? And it's about just greater freedoms in their own lives, to be able to make choices, to be able to change the world for the future. That's what we want for kids, right? And so I think that's one really important one. And I think the other one that feels incredibly valuable, particularly to me when I sit in Pakistan, at least the discourse is very much in education. When we talk about change in education, it's almost like we don't believe that system change is possible. So much of the conversation around education is about, let's build a few schools, let's donate some books, let's train some teachers, because we are so skeptical that system change is even possible. And so I think Teach for All kind of cuts through that and says, yes, that we have to be able to imagine it together first, but yes, it's possible.
Possible is always the important word. And I'm going back to my own experience. Everyone said PEPFAR was impossible. No way Africa could deliver therapy. Millions of lives later, totally proven wrong. And going back to naivete, if I actually knew how the US government worked before PEPFAR, I wouldn't have thought it was possible. So it's always good to have be a little naive when we do these things. There was a comment in the chat by Onyeke, I'm not sure I'm pronouncing that correctly, about centralized governmental systems, and that being a barrier. That local government is always closer, and that's been my experience. When you get down to local governments, they try, but they have these dictates from above, which often is from the government and or from external sources that give directives, which is a massive problem. But I didn't know, Onyeka, if you wanted to say anything or just leave it as a comment in the chat, but want to give you the opportunity to jump in if you want.
Hi, good evening. Thank you very much. So that comment came up, I think, when Lauren was talking about the government's response to COVID-19 in Liberia. It's been an experience in Freetown. I work as a senior health advisor to the mayor of Freetown. And so managing the COVID-19 response was very challenging, but thankfully we had several lessons that had been learned from Ebola, and we're able to apply it to the pandemic. Again, many times we talk about interventions, but in our experience, and one of the most difficult challenges, as you have stated, is how do you get access to the people? Many times when governments are making policies, formulating policies, and implementing policies, we look at the communities that we are implementing these policies for, formulating and implementing these policies for, as an offshoot or just external agents. We forget that these are our primary focus. We forget that we have to carry these people along, and as a
Unfortunately, we lost you there for a second. Sounds like you're about to make an awesome point. Hopefully we'll get you back in. If you can get back in, just jump in. Because I think the point you're making is a very important one. I actually just heard on the Daily, the relatively new Minister of Health, Austin Denby, who helped start PEPFAR and was part of CDC. Now Minister of Health in Sierra Leone, and brings a lot of experience. I hope you get a chance. I'm sure you're working closely with him. But an excellent point, and I think you also made this point a little bit, Cornelia. The networks that were built around the Ebola response were kicked in for the COVID response, and same with HIV, malaria, TB, maternal child health. So investments in things that take lives today can have a big impact when we have future challenges. But integrating, as we've been trying to point out throughout this conversation, integrating across different fields, because we're talking about people, not diseases. Pandemics are social. They're not just a virus. And the conversation has been fantastic, and the three different leaders talking about their experience and where they came from to get to where they are, but also reflecting on the way, what you've seen and how things need to change. And there's been so much in this conversation. I hate saying this has been a rich conversation. First of all, we shouldn't say rich or poor to begin with about anything, but it also just seems like diplomatic doublespeak. So I won't say that. I will say it's been a fantastic conversation with a lot of insights. And the focus on doing things differently, envisioning a different path, and then giving the space for the people like our three speakers and all of you to engage is the only way we're going to get through the future. But it's hopeful and promising, as each of the panelists has said. So I know it's late for some of you, including Khadija, who's, I don't know what time it is in Pakistan, but I'm guessing it's well into your evening at this point. Same for Cornelia and Lorraine and many of you on the phone. So thank you all for joining us. Thank you to Skoll for sponsoring, and for the other sponsors and members of the community. And everyone have a great weekend. And thank you again to the panelists for your insights. Really appreciate it. Nice to meet you all. Have a good evening, morning, wherever you are.
Thank you.
Bye.
Goodbye.
Thanks, Mark. Thank you. Bye-bye.